Hello, my name is Dorian Terry, and today I will be discussing heart disease in women. Heart disease in women is so important because heart disease is the number one killer in women in the United States. So many women die from heart disease, and it's very important for the woman to know actually what truly is heart disease and the signs and symptoms, as well as some preventive techniques for women to combat heart disease. And heart disease affects women all over the world, all kinds of ethnicities, and so it's very important to be aware, the risk that are associated with heart disease. And so what you would actually be learning from this lesson today is some symptoms, learning about the symptoms of heart disease and how it affects women, and learning some preventive methods to kind of combat heart disease and lower your risks for heart disease. And you will also learn at least 2 exercises from the game that we will play later on in the presentation. And I know a lot of women actually exercise, and exercise is becoming a big deal in the past couple of years, and not even just past couple of years. A lot of people know the importance of exercising, so it's very important to be aware of how exercise can aid in the prevention of heart disease. So what is heart disease? Well, heart disease is a buildup of a plaque in the arteries, and what this actually does is it makes the heart work harder. So if the heart has to work harder, and the woman is going to be very symptomatic of the things that are associated with heart disease. The woman may feel increased heart rate, or shortness of breath. The woman may actually feel like she's sweating. I mean, all these heart related symptoms are very important, because this is all because of the buildup of plaque in the arteries, and the heart has to work so much harder when those arteries are constricted. So it's very important to understand exactly what heart disease is. The signs and symptoms of heart disease. Well, as I just stated before, you may experience a shortness of breath. You feel like you're out of breath, and that is definitely something that is, it can be interrelated with other it can be symptomatic of other diseases, but it can even be symptomatic with anxiety. So it's very important to understand, separate the two between anxiety and heart-related symptoms. But shortness of breath is actually one where you feel like you're out of breath. You feel like you just ran a marathon, and or just suddenly you just feel like you can't catch your breath, which will lead to a faster heartbeat, and you may also experience weakness because considering that you feel like you can't catch your breath, your heart will begin to beat faster because you're taking in so much air trying to actually catch your breath. You may experience some weakness or dizziness just because that could be also interrelated with hyperventilation, because when a person hyperventilates, they're inhaling a lot of O2 gas, And what that actually does is that person may experience some tinglingness or dizziness or weakness in their body, and you know, people tend to pass out. And so that is definitely, weakness and dizziness is definitely something that attributes to that. And you may experience some nausea and sweating, which, as I said before, is all of these symptoms are so interrelated. It's very important to understand how these symptoms are interrelated with one another. And except heart palpitations. Heart palpitations are that is a symptom that can actually be, you know, it's very more. A person should not be experiencing heart palpitations with anything. And so if a person experiences something like this, or any of these symptoms, it's very important to contact your primary care physician, and or call 911, depending on severity. Okay, so test your knowledge is pretty much a mid-presentation kind of you know, quiz, if you will, just to ensure that, you know, you're retaining this knowledge. And I know a lot of you women may actually know these things already. So this is, if this is a refresher course to you, then this is amazing, because, you know, this means that, you know, more women are becoming more aware of the severity of heart disease and how it affects our women. And so, you know, we are you're already taking the necessary steps to actually lowering your risk for heart disease. So what are some symptoms that may indicate heart disease? You know, heart palpitations, shortness of breath, weakness and dizziness, nausea, sweating. You know, like I said, you know, you experience any of those signs and symptoms, you know, you should definitely dial 911 or contact your primary care physician. How long do symptoms usually persist? Well, that can vary from person to person, as well as these symptoms. So it's very important to be aware of the symptoms first and how they affect you individually. And here are some preventive methods that to aid in the prevention of heart disease. One, you must follow a healthy diet. A healthy diet is so important because, you know, you lower your risk for obesity, and which obesity is definitely something that can attribute to heart disease. That's a risk factor. And you know, with a healthy diet, healthy nutrition in place, you know, your heart makes your heart work that much easier. So the easier your heart has to work, just the better that you will feel individually and overall. Just have a better quality of life. Maintain physical activity is so important. It's so important because, you know, you do cardio, you exercise, you know, that just strengthens the heart muscle. The heart is actually a muscle. So when you actually work out and exercise, you are strengthening that muscle to become stronger, and it works more efficiently. So it's very important to maintain physical activity. Don't smoke, and you know, don't smoke or use any kind of drugs. I mean, smoking is just, it's so many reasons why smoking is bad, and people that actually smoke know it's bad, but you know, they deal with a lot of stress related issues or whatever the case may be. And so, you know, without getting too much into smoking, because, you know, most of you women know that smoking and the dangers of smoking, it's just not good to smoke. And, you know, a lot of people may have family history in heart disease, so it's very important to be aware that, you know, this of what smoking actually does to your body. So this is a test your knowledge too. So What are some preventive methods that can lower your risk for heart disease? Maintaining physical activity, a well-balanced diet, don't smoke at all, and don't use drugs. I mean, it's just smoking is just bad. It's just it's just not something that you want to do. I mean, there are so many other things that can relieve stress. Smoking is just not one of them. Being physically active, is that an important tool to lower risk for heart disease? Well, yes, because it strengthens the heart and makes your heart work more efficiently. Is smoking bad? Of course. As you can see, I put yes, just in case, some of you women out there are all this is just going to go one ear and out the other because you already smoke. You're probably going to smoke after this, but, it's very important to maintain a healthy diet and don't smoke. Okay, so this is a game where, this is designed to teach women, how important exercise is and lowering the risk and preventing heart disease. I mean, exercise is so important. I mean, it can help, it can help lower your blood pressure and it can reduce your risk for diabetes. So the way to play this game is everyone's going to form in a circle, and I will perform an exercise up front. And so after I complete the demonstration of the exercise, I will call on one of you guys. So all you guys are pretty much be in a team, and you guys will try to figure out what the exercise I'm doing. And so if you guys actually get this wrong, then you actually have to come up here and demonstrate it in front of everyone and tell everyone the importance of this exercise. Now, it's 20 of you guys, so I expect you guys to get this right. So you won't have to come. You won't have to come up here and explain to everyone the importance of the exercise. So pretty much, if you can get all these questions right, it'll just be me telling you guys about the importance of these exercises, and just giving you more exercises that you may not know on the prevention of heart disease. And this next, after we finish that, we will be we'll be watching a video on heart disease. Pretty much, it's just elaborating on the signs and symptoms of heart disease, and also be talking about the different types of heart diseases as well. I know a lot of people are unaware that of the different types of heart diseases, like congestive failure, or what's another one? Just so many different types of heart diseases. So it's definitely important to know the different types. And so this video will definitely elaborate more on what has been discussed. The importance of Howard Gardner's multiple intelligences. Okay, so this is pretty much a tool that Howard Gardner implemented, and it pretty much talks about how people are depending on their background and what they've been exposed to earlier in life, are different types of learners. So, say for me for instance, I was exposed to music for growing up, and all I wanted to do was music. So later in life, it was made that much easier for me to excel in music. And you can apply that principle to other phases of learning, where whether a person is better in math, or a person is better in logistical thinking, such as like comprehending literature, someone is more comfortable with things that deal with the environment, etc. I mean, this principle, this theory is it pretty much is address the different learning styles an individual may have. So that is the reason why I implemented the game and the video. It's because I know there may be people that like to be active, or there may be people that like to be a spatial learner, which is the video. So it's very important to implement the different learning styles, just so you can ensure yourself that you're actually retaining the material. And so I hope you guys enjoy the presentation today. These are just a few references that I used for my presentation, and hope to talk with you guys again. Now I'll be handing out a worksheet for you guys, like I stated in the beginning of the video, outlining the objectives, and just assess your knowledge on signs and symptoms and preventions. So I thank you guys again. My name is Dorian Terry, and it was a pleasure.